I think a lot of people stumble because they think acute pain is simple compared to chronic pain. Probably the most common response we got, though, and I often get, is how do you manage acute pain in folks that are tolerant, have chronic opioid therapy or have chronic pain? So how do you treat patients with chronic pain and opioid tolerance when they have acute pain conditions? I think that's probably one of the biggest challenges. It's similar to kind of the general principles. It's using a plan of care, multimodal analgesia, having an interprofessional team, understanding what the goals are realistically in terms of recovery, not just focusing on a single thing like opioids. All patients deserve pain treatment, right? Using appropriate principles. And whether patients have the disease of addiction or substance use disorder or not, they may need opioids in their lifetime. Exposing people to opioids does not cause this complicated disease, this biopsychosocial disease of addiction. Certainly, when people have that disease present, we have to be very vigilant and careful and have clear guidance about tapering opioids and looking at their risks around that. But there's no evidence that using opioids to treat acute pain is going to cause relapse. And probably, if anything, it's going to, if we undertreat patients with opioids, it's going to cause more problems. People will probably go out and, look for illicit sources and stuff. Someone asked me after my talk about whether we should refrain from using opioids, try to detoxify patients with substance use disorder in the hospital while they're there. And there's really little evidence that that has anything to do with their sobriety. In fact, it just puts them at risk for overdose and death when they leave the hospital. So I think we have to use pharmacologic principles, we have to think about safety, but we can safely use opioids in all patients, including patients with substance use disorder. But it takes multidisciplinary plans of care. I think it takes a multimodal approach using other strategies in addition to opioids. It's really surprising when you ask people about their addiction history, often how open and honest they'll be. I mean, you have to establish trust and rapport with someone. They've often been through a lot of poor medical encounters, where they've felt a lot of judgment or been treated inconsistently. But people are often very open and honest about what they are using. And sometimes it's pretty obvious, too, in terms of what brought them to the hospital and, again, using some universal precautions with doing some urine drug testing to uncover kind of what substances are present when people are in the hospital and they appear intoxicated and stuff. But people are usually very open and honest about that. And I think, you have to thank them for that open honesty and say, it's important for us to know that so that we can give you better, safer care. It's okay,